You're welcome to Mother and Child Hospital Antenatal Clinic. I am Nurse Akibi, and I will be your anchor for the program today. We shall be discussing about labor, which is our topic for today. And I hope you will enjoy it as you stay tuned. If you have any question, you have to wait till the end of the presentation for you to ask me whatever you want to ask me. Just pick a pen and a paper and jot down whatever questions you have for me today. Thank you as you listen. Well, labor is the presence of regular uterine contraction with a progressive cervical dilatation and effacement. What I mean by dilatation is when the cervix begins to open so that the baby can come out. And then effacement means the taking up of the cervix. I'll bring it down to our level in this program. When I mean taking up, it's all about the cervix is usually long, but when effacement is taking place, it begins to pull up. As it is pulling up, it is creating room for the cervix to start opening, for the baby to be able to come out. And this occurs at the last month of pregnancy, which we all know is 9 months. Although there are several physiological changes that occur before the beginning of labor, of which one of them is Braxton Hicks contraction. Braxton Hicks contraction is just the painful contraction you experience during pregnancy. What are the signs and symptoms of labor? There are several signs and symptoms of labor. Number one on the list is lightening. We call it lightening, as in something becoming light. Something that doesn't have weight, lightening. This occurs 2 to 3 weeks before labor commences. What actually happens is that the lower uterine segment, that is the lower part of the uterus, becomes expanded, sort of, and allow the baby's head to sink lower. During this time, the upper part of the abdomen becomes free, enabling the woman to breathe more freely. Another symptom or sign, rather, is frequency of menstruation. Simply means the passage of urine frequently. As a result of lightening, because the head is now directly pressing the organs of the pelvis, it makes the capacity. Hello, I hope you people are hearing me. Hello.
We can hear you, ma. We can hear you.
Okay, thank you. So Because of lightning, the capacity of the bladder becomes reduced because the head is pressing on the organs of the pelvis, thereby reducing the capacity. This now makes the woman to urinate more frequently as against when the head of the baby was high up. Also, another thing that can cause frequency in micturition is the relaxation of the pelvic floor muscle, which could cause poor sphincter control. The sphincter is located at the neck of the ureter. So when there is poor control of the sphincter, of the urethra, the sphincter rather, sorry, breast incontinence. For example, because of the pressure and all whatnot, when the woman, maybe for some, when they laugh, as a result of pressure mounting on the abdominal wall, it can make the woman to just pee a little, not too much, just little. It happens in some women. Then another thing is low back pain. This happens as a result of the pressure mounted on the pelvic region from the head of the baby. That is why you see the woman having low back pain. Then painful contractions, which becomes stronger as labor progresses. These contractions occur when the woman is about or ready to give birth. Then we have what is known as spontaneous rupture of membrane. Spontaneous rupture of membrane simply means the water breaking. Some women break their water before they come to the hospital. Some, it is the hospital that will, the nurse or the doctor will break the water. So it is part of signs and symptoms of labor. Then we have increased vaginal discharge, which is known as leukorrhea. During the latter period of pregnancy, when labor is about to start, there is usually increased vaginal discharge. Then, women that are near delivery, they usually have disrupted sleeps because of discomfort. You see, most women will come to the hospital, they will tell you, when I lie on this side, I cannot lie down comfortably. I put my, I lie on the other side, it's not comfortable. So when it is getting to the time a woman will deliver, she is bound to experience such. Then soreness of the breast, because the breast is full with breast milk at that point. The breast is ready to be suckled by the baby. So the breast becomes painful with everything. Another thing that the woman sees is show. We call it the operculum of the cervix. It helps to prevent infections from the outside, going in to meet the baby there. It is just a bloody mucus stain. When the woman is ready to deliver, as the cervix is opening, there will be a dislodgement of that thick mucus. Most women will come, they say, I have seen thick mucus in blood. Yes, it is normal. That is just a sign that baby is ready to be born. Then that ends the signs and symptoms of labor. Let's now move to the nature of contraction. We cannot talk about labor without contraction. So contraction is part of it. During labor, the uterine muscles, they begin to contract. These contractions are painful, but not as painful as, in the beginning as towards the end of labor. The contractions increase in strength and frequency until the baby is delivered. Two things usually happen when contraction takes place. Those two things are, number one, the contraction will cause the cervix to thin out. So when it thins out, it makes the cervix to become dilated, meaning that it will help to open the cervix. And then the second thing that it does, the contraction does too, it helps the baby to descend into the birth canal. And this contraction comes in form of tightness of the abdominal muscles. When contraction is ongoing, if you touch your tummy, you will see it will be hard, sort of. That is contraction. Intervals of contraction now. The interval of contraction simply means the length or duration of the contraction. In between the contraction, the length and the duration is equals to the interval. From one contraction to another contraction. That is just the interval, and then we talk about the length too of the contraction itself. Initially, when contraction starts, it is not frequent. They don't come frequently initially. It takes like about 15 to 20 minutes for another contraction to occur. Then, when the contraction continues for a period of time, it begins to increase and then becomes more regular, and then you can have less than 5 minutes apart between contractions. That is for contractions. We have just talked about the nature of contractions and then the intervals of contractions. Now that brings us to the stages of labor. We have 4 stages of labor. The first stage is the beginning of contraction, the beginning of the dilatation of the cervix, that is the opening of the cervix, to when the cervix is fully open. And then we start counting from 1 cm to 10 cm. When the cervix is 10 cm, it means that the woman is about to deliver, is ready to push out the baby. But it starts from 1 cm and gradually the dilatation increases, meaning the opening increases until it gets to 10 cm. In the first stage of labor, there are two phases. We have the latent phase, which is the dilatation, that is the opening from 1 cm to when it is 3 cm. That is latent phase. At that time or that period of labor, you have to everything that you want to do around the house, because labor at that time is not serious, the pains are mild compared to the second phase, which is the active phase of labor. The active phase of labor is when you have the contractions coming more frequently and then lasting longer. And that phase is from 4 cm to 10 cm. That is first stage. Then we move to second stage of labor. Second stage of labor is when the cervix is fully dilated to when the baby is born. This period, the contractions helps the baby, helps to push out the baby down into the canal, and you may feel the urge.
Oi,
Hello?
right away.
Okay. You may feel the urge to move your bowel. That is, you may feel like poo-pooing at that time. It is normal. It is even in this stage that the water breaks. That is, I mentioned it when I was talking about signs of labor. It is during this stage the water breaks. That is not to say that it happens in every woman. For some people, their water may break earlier than that, which is not normal anyway. So the water breaks, and then the head has descended fully into the pelvis in this stage. And this stage, it only takes 15 minutes to 1 hour in women that have delivered before. It could last up to 2 hours in women that have not delivered before, first timers. That's the second stage is a very short stage. It is shorter than the first stage. This is when the baby is born. Then, the third stage, that brings us to the third stage, which starts from the delivery of the baby to the time the placenta is delivered, the placenta and the membranes. During this time, the moment the baby's head comes out, contractions are less painful. They are no more painful as when they started. They become mild, and then this stage lasts for 5 minutes to 30 minutes. But could be up to 1 hour at times. The fourth stage, we have the fourth stage. It is not because the woman has delivered and then blah blah, we just rush the woman. No. That is why the fourth stage is that period of time we keep the woman, we move the woman from the labor room to back to the room where she started from, and then keep her there for some time before she moves to the ward. It is just the first 2 hours to 3 hours after birth or after delivery. During this time, the mother, the newly delivered mother, might experience some kind of tremors, chills, as well as discomfort from the afterbirth pain. That is where you hear the woman say, "Oh, my stomach is paining me." It means that the uterus is returning back to its previous state of a pre-conception state, the state it was before it harbors the baby. So when the woman delivers, after delivery of the baby and placenta, the uterus begins to contract. Number one, it is contracting so that the patient will not bleed. It's a form of bleeding control. That's one. Then number two, it is trying to go back to its pre-conception state. Some women also suffer fainting. They may feel dizzy or faint during this period. That is why we usually keep them, let them rest for a while, and then um, ensure that they are okay before we move them to the ward. This is also when the woman suffers pain from the episiotomy site or tear. You know, there is episiotomy, there is self-tear. The vagina opening can tear on its own, or the nurse or the doctor can as well give an episiotomy. We shall discuss about episiotomy, I think, in a few seconds time. Then also, for women that have hemorrhoid, this is when they say the places, their bum, their anus is paining them. That's the first stage. In all, it's all a beautiful experience. That brings us to the next topic, which is breathing exercise during labor. I noticed that some women, when you tell them do like this, breathe like this when they are in labor, at times they don't do it. Oh, they really need to do this. No, it is necessary. Even before you come to the labor ward, it gets to the point whereby you are in labor. It is proper that you start practicing the breathing exercises at least 2 weeks before you fall into labor, so that you get used to it. So that by the time you come to the labor ward and you are told, breathe this way or breathe that way, you'll be able to do it perfectly. Breathing over the time have been discovered to help in pain management. If you breathe, follow the breathing pattern you are asked to adopt while in labor, you discover that the pains from the contraction will be a bit relieved as compared to when you don't do it at all. So that is why it is good to learn it now that you are still pregnant. Then by the time you come to the labor ward and we ask you to breathe this way or breathe that way, you'll be able to do it perfectly. And then you will see the effect that time because you compare it with when you are not breathing that way and when you are breathing that. You compare the two together, you know that breathing helps to the breathing exercise helps to reduce or control at least pain to some extent. Well, to start with, during the first stage of labor, it is expected that you take slow, deep breath, something like you take slow, deep breath as your contraction starts, and then you slowly breathe out, releasing the, trying to release the physical tension from your head to your toe. This is often referred to as organizing breath. You take in slowly. As the contraction is coming up, you just take slow, deep breath. And then you exhale, focusing on the relaxation of different parts of your body. You try to release the air through your mouth. You breathe in slowly and then you release it from your mouth. Yes, you just open your mouth a little and then breathe out slowly. You breathe out slowly through the mouth. This will help you to relieve some tension and then some of the pains.
How are you?
To help you
Hello,
to
good.
relieve the pain. Sorry for that. I just muted the person that was making a noise there. So, like as I was saying, I said breathing exercises during the first stage is called organizing breath. And what you do is you take in deep breath through your nostrils, something like this. You allow it to go deep down and then you exhale slowly through your mouth by opening or gaping your mouth a little and you breathe something like this. You breathe out slowly. You inhale through your mouth and you breathe, through your nostrils and then you breathe out through your mouth. Focusing your mind on trying to relax one portion of your body at a time. Let me say, for example, if I'm breathing and I want to relax my legs, I'll focus my attention on my leg. That is how it works anyway. You focus your attention that I'm releasing, I'm breathing out now. I want to relax my leg. Okay. Um, this type of breathing, you do it often. As the contractions are coming, you do it. Then in between contraction, you can relax. Then during active phase of labor, that one is during first stage. And I told you that first stage is divided into two. We have the latent phase and then we have the active phase. So coming to talk about the active phase now, it is during the active phase you have more pain. That is when the pain becomes more severe. So during this time, you also breathe in, you maintain the breathing pattern, which I've just mentioned, that is breathing through your nose slowly and then breathing out through your mouth. But what you add to that is that, excuse me, you keep breathing slowly, as slow as possible. Then the speed of your breathing should intensify as the contractions increases. That's just, and then you try as much as possible to relax your shoulders, meaning that you should be in a comfortable position. Whether you are lying on the bed, you are sitting, you should make sure you relax your shoulder and then allow the breathing to sink deep down. As the contraction peaks and your breathing rate increases, you now switch to light breathing pattern, in and out. You make it light. As the contractions, they are getting to the peak, and then when it gets to the peak, you will relax a little and then you start again. At that period, you switch to light breathing, which is your normal pattern of breathing. Then when the contraction comes again and the intensity increases again, you repeat the cycle all over again. Maintaining breathing with your taking in air with your nose and breathing out through your mouth. Then, during second stage, you still do the organized breath. Now it is time to focus your mind on the baby moving downwards and coming out. So by so doing, by focusing your mind now on the baby, it removes your mind from the pain. That is just the idea. It will help you to remove your mind from the pain because you are directing your attention to the reason why you are in the labor ward, which is a thing of joy. So for that reason, your mind will be drifted away from the pain. Though it may not be completely, the pain may not go completely, but the intensity of the pain will not be as much as when you are not focusing your mind on your baby and when you are not doing any form of breathing exercise. So you will ensure that breathing is still slowly and then follows the pattern of your contraction. As the contraction comes, you adopt the breathing exercise until when the contraction stops again. And during that time, the contraction stops, it gives you room to rest. So then you should ensure you maintain a comfortable position. Anyway, at that time, at this time, it is the nurse that will even help to position you the way and manner you will stay to push out the baby. And then when it is time for you to push, when the nurse asks you to push, you are expected to push when you have the urge, when the contractions are there. You don't push when there is no urge and when there is no contraction, because if you do, it will cause damage. And what damage does it cause? It will, the pushing will help to, the baby's head will tear you. It will tear your vaginal wall the way and manner you will not like, or rather the nurse will not like, or the doctor, because it takes suturing again. That's another part of it. So you are expected to push when the nurse or the doctor tells you to push, and then you are expected to push when there is a contraction and when there is the urge to do so, not when there is no contraction. During that period in between contractions, you are expected to relax, because that is the only period you have to rest. That is the only period you have to gather more energy to do the pushing, because you will use some energy in doing the pushing. So when it is time for you to bear down, what you do is you take a slow, deep breath, and then you push as if you want to pass out constipated stool. You use all your strength, and then your abdominal, you use all yourself. You apply all yourself into the pushing. You use all your strength, your abdominal muscles, and then push as if you want to pass out constipated stool. You know how we do it now when we eat a lot of bread and then we are constipated. When we go to the toilet, you are pushing. That is, it's almost the same form. You push with all your strength. But this time around, the pushing will be more vigorous than, because it's for human being that they are pushing out, not to this time around. That of pushing out is milder than when you are pushing out a baby. So that's that. And then when you are pushing, you are not expected to, some people when they are pushing, they push with their neck. No, you can let out air. Just make your mouth in form of a zero. When I told you that you inhale, you take a deep breath, and you muster all your energy to push, you can just do something like that as you are pushing. You can do something like that and then push. Then you'll be surprised at the results that you will get. So it is time for us to talk about episiotomy. Episiotomy is just a minor surgical procedure that is done in the labor ward for a woman who is in labor. The reason why we do episiotomy is to increase the outlet, that is to increase the vagina, so that the baby will be able to come out freely. One, if the baby is too big, too large for the opening, and we don't give episiotomy, and then you ask the woman, and then the woman is pushing, it means that it will tear, it must have to, the baby have to come out. It has to come out. And for it to come out, it will create a path for it to come out. It will create a way for it to come out. So for it not to cause a lot of damage to the mother, what we'll do is we just give you just a small cut to increase the space for the baby to come out freely. That is just what episiotomy means. And after everything, after the baby has been delivered, the placenta too has been delivered, what we do is we repair the cut, we suture it back to the way we met it, so that our daddy will not be angry. We beautify the baby, make sure the place is okay for you to be comfortable. So that is just all about episiotomy. Then there are ways you care for episiotomy. When you have an episiotomy done, we normally tell the woman to change her pad often to prevent the place from being wet. You know, after delivery, you still be seeing, we call it low care for some time. When the surface of a wound or any wound is always wet, it does not allow for proper healing of the wound. So the idea of changing your pad often is just to ensure at least we maintain some level of dryness on that area for it to heal properly, so that there will not be wound breakdown. For your information, episiotomy can break down if not properly taken care of. That's number one. Number two, to care for your episiotomy while bathing, you should ensure that you wash that area properly. You ensure you wash. Just wash with ordinary water, or you can put a little bit of salt. Not inside though. You are not expected to use the towel to wash your inside. Outside, just where that suture is, where the area that was sutured, that's all. And then you keep it dry. You should not use anything hot, either hot compress or hot water on that area. Reason being that if you do, the material that was used in sewing that place, in stitching that area, will melt. And you know what that means. If it should melt, it means that you will come back again for a secondary repair. So never use hot water or hot compress on that part of your body. I know our old mummies at home, I mean our grandmas and neighbors will tell you, no, go and sit inside hot. Don't do that. They'll tell you, go and sit inside hot water, do this, do that. You don't apply anything on it. You don't sit on any hot water. It will heal on its own. And then finally, it is expected that you take your drugs. There is no how you have an episiotomy done for you that you will not be given drugs that will affect healing. You'll be given antibiotics. And then if you eat well, good food too makes wound healing easy. If you eat good food, balanced diet, after delivery, you discover that your body system, everything will come back to normal on time. You regain back your strength, gain back everything you have lost while you were pregnant on time. And then your episiotomy too will heal on time. Well, for your information, it is not all deliveries, it is not in all deliveries that we give episiotomy, no. Even some women that have not given birth before, so long as they are rooming, they can deliver without episiotomy. So episiotomy can only be done or be thought of during the process of conducting delivery. You don't earmark an individual that, okay, this person, because this person is a first timer, or because this person is this, that we are going to have episiotomy. No. It is during the process of conducting the labor that we now decide. When the vaginal wall is overstretching, we now decide, okay, and we know that if this thing, if we should allow it to get torn on its own, the tear might not be too good, then we now decide, okay, let's give. That is when it is stretching. You even see it that it is stretching and then some crack, the skin is cracking, then we now decide and give. So I think that brings us to the end of this lecture or the antenatal class. If we have any question, I think we are free to do so. So I am open to your question right now. So I want to thank you all for listening and then also thank you for participating. So I am waiting for your questions. Let me see, open this thing. Unmute. So I'm open to questions. You can unmute yourself and ask me any question. Hello? Hello?
Hello, ma. Good afternoon.
Yeah.
Good morning, ma.
Okay, good morning.
Thank you so much for the lecture.
Yeah,
So my question is really around the whole labor process. It's more of the practice, labor practice, delivery practice of the hospital. So the first thing I want to ask is, does the mother and child have like a delivery gown, something that they give to mothers that are about to deliver? If they do, good. If they don't have it, what do you suggest that we wear when in labor and coming for delivery? That's
Okay.
my first question.
Okay.
My second question, ma, is that this practice of once the baby comes out, you give the baby to the mother for skin to skin. The cutting of the umbilical cord is delayed by like 3 to 5 minutes. So I've been reading up about that and the benefits. of delaying the cutting, like maybe 2 minutes, 3 minutes after the baby comes out before you cut the umbilical cord from the placenta. So I just want to know what the practice is at mother and child. Do they do skin to skin, or they just deliver the baby and go to bathe the baby? Also, do they bathe the baby, or you just clean the baby and leave the vermix? Forgotten that white stuff starts with the baby. Do they leave it?
Okay.
So
Okay.
leave it.
I'll-
So it's more of the practice of the hospital, not really about the process. Thank you so
Okay,
much,
okay,
ma'am.
okay. No problem. Thank you for the questions. Number one, you talked about uh, the practice of the whether we have gowns for mothers, isn't it? Yeah, we do. When you are coming to mother and child hospital, you don't need to come with any of your clothing apart from the one you wore while coming, or and then the one that you wear while going back home after the process of delivery. All our admissions here, both inpatients, delivered mothers, in the theater, we have different wears for different categories of our patients. So our hospital policy here is that we give you what to wear. Okay? Then in the area of bathing the baby, no, in the area of putting the baby uh, uh, to experience skin to skin, well, it depends on the condition of the baby. It is the condition of the baby that will depict what we'll do at that particular point in time. If we have issues, then at that point in time, there is nothing like skin to skin. But if the baby is fine, we do skin to skin here. It is just the skin to skin is all about bonding. The first person the baby comes in contact with in life, apart from the nurse or the doctor that conducted the delivery, is the mother. So the mother uh, carries the baby, and then if there is opportunity for the baby at that time, it is true because help uh, uterus in contraction helps to control bleeding as well. But for some, it depends on the nurse duty. It depends on the condition of the baby, the condition of the mother. That is what will depict what will happen in the labor ward. Then coming to cutting the cord. While we leave the cord for like 2 to 3 minutes, is for baby to get enough blood from the mother through the placental link. That's all. After which we now cut. Then coming to bathing of the baby. The baby is coming from a sterile environment. I hope we all know that. And what we do in mother and child is we clean up the baby. That is why you have olive oil in your, as part of the things you should bring to the hospital. We clean the baby very well, although the vermis caseosa on each child differs. Some, they have plenty of it on them. Some just have mild, just little of it on them. The vermis caseosa is just a whitish, sticky substance that is on the baby's body. Well, since baby is coming from a sterile environment, that is number one. And two, baby has undergone stress. It is not only the mother that passes through stress during the course of delivery. The baby too passes through stress. Navigating and negotiating passing through the canal to come out is stress on its own on the part of the baby. You could see that some babies come out limp, very weak and tired. That is to show you that they did a lot of work. Just as the mother is working to bring out the baby via contraction, so also the baby is working inside, using his head to look for the way to come out. So at that point, the moment you deliver, we don't bathe babies. You only clean them very well. You will not even see trace that that baby has not taken its bath. Then we put on the clothes, wrap the baby. But the following day, if you are lucky to deliver early hours in the morning, maybe like 5, 6, then baby will rest. When they are bathing babies, they will bathe the baby alone. And if it is in the afternoon, then baby will wait till next morning. Besides, if you have a preterm delivery, nobody prays for it. Babies don't bathe for like 2, 3 months. So baby is not dirty. The environment from which baby is coming is very, very sterile. Although in this part of the world, we say if you don't bathe baby very well, baby will be smelling. Madam, that is a lie. There is nothing like that. What about babies that did not take their bath for 3 months? I mean the pretense. They don't smell. What causes smell in the body is a very different thing, and it's a different thing entirely. It is the sweat, it is the sweat gland. That is where you have the substance that causes smell in the body. There are some of us that our mothers use oil to scrub our body and bathe us with this sharp sponge, yet you still find such people smelling. It doesn't mean that they did not bath them very well. So I think I've been able to answer your question, madam. Hello? Hello? Hi. Hello? Jesus. Hello? Hello? Hello, madam. Hello, ma. Hello, ma. Hello, ma.
Hello, ma. Yes, the questions have been.
Have I been able to answer your questions?
Hello. Answer.
Yes, ma.
Yes, you have. Thank
Okay,
you so
thank
much. I
you.
appreciate the time. Yes, you have been able to answer my questions. Thank you.
Thank you, ma. Yes, ma.
All right, ma. Yes, ma'am.
Okay, ma. Thank you, ma. Hello, house. Do we still have anyone that has questions?
Good morning, ma.
Good morning, madam. How are
Thank
we?
you for the class today. It was really
Yes,
educative. So I have some questions that are also around the procedure of the hospital.
okay, no problem.
So I want to know if you have birthing options. Like, for example, do I have to lie down while having the child, or I can assume other positions like kneeling or standing? Then do you also have, in mother and child, do you have the options of water birth? Is that option existing? And is this something I can ask for, or it is my health that will determine if I can have a water birth or a natural birth or a vaginal birth? Sorry. I don't know if you understand my question.
That's water bed. It's like I'm misplacing it. Water bed is all about being in a little pool.
Yes, ma'am. Yes, ma'am.
It's different from whether you are having vaginal option or not. If The options we have here, one, it could be a CS. You can opt for a CS if you choose that. You can opt for epidural, no pain delivery. Okay?
Okay,
I hope you
ma'am.
understand what I'm saying.
Yes, ma'am.
No pain delivery, you can opt for that, which is epidural. But before an epidural will be conducted on you, the gynecologist will have to examine you, know if the possibility of your giving birth vaginally before the epidural can be done. Then for water birth, for now, excuse me, we don't have that facility. Then for the position, well, in Nigeria, let me say in Nigeria as a whole, we are used to lying on our back. But if somebody like me, if I'm on duty and you opt for whichever position you want, if I feel it is okay for your health, I can be able to at least do that. But majority of the nurses you meet here will opt for you to lie on your back. Have I been able to answer you? Hello?
Yes, ma, you have. Thank you so much.
Okay, you're welcome. Hello, house. Is there another person with question? Hello? Hello, house. Hello?
Hello, ma. Good afternoon, ma.
Good afternoon, ma.
Yes, ma. Thank you for the lecture. Yes,
Thank
ma.
you.
Is it just the nurse that take the delivery, or will there be a gynae or something in the labor room?
Yeah, we have doctors in the labor room. The gynae too could be available. It depends on the condition of the patient, but the first person you come in contact with, that is if the gynecologist is not around, because you cannot be all they can. It is not only one gynecologist we have here. They cannot be around 24/7, but there is always midwives. You know, delivery is the job of the midwife. There are midwives all the time present in the hospital. And then if after assessing you, there will always be a doctor available, they feel that the gynecologist should be involved, they will call the gynecologist, he will come over. But not only that, the moment you are in the hospital, the gynecologist will know, because both the doctor and the nurse that will attend to you will alert them that so and so patient is in the hospital. Then he, the nurse, and the doctor that's available will monitor the patient pari passu. He might not be around, I mean, the gynecologist might not be around, but whatever is going on at every stage will be passed across to him. So if they've discovered that, okay, his attention is needed or he needs to be around, they will call him. They will let him know. He will come immediately. They stay around us here.
Okay, ma.
Their houses are not far.
Okay, ma. Thank you, ma.
You're welcome. Is that all? Hello, house. Is there another person with a question? Hello, house. Hello. Hello, house. Oh, I forgot I did not record this thing.
Hello.
Hello, good morning. Good afternoon, sorry.
Okay, good afternoon, ma'am.
Good
Okay, my
afternoon.
name is Mrs. Ladipo. So my question is, if a woman already had CS for the first child,
Yes.
can she do vaginal birth for the second one? And if yes,
yes, depends. We call it feedback.
Okay.
It is called vaginal birth after cesarean section. It is possible, but the possibility is very slim. Okay? Because the reason for the CS will be put in cognizance before one will say, okay, this next baby, let's try. It is always a trial, okay? It is not that, okay, because you have had it before, you have done a CS before, okay, this time around, it has to be vaginal delivery. So it must strictly be vaginal delivery. No such thing. Because the previous CS, number one, the doctor will want to find out why the CS was conducted. Was it as a result of what do I call it? As a result of the passenger bigger than the passage, or the passage is smaller than the passenger, something like that. I hope you are getting me. Or
yes,
is it malpositioning? Is it that the opening refused to open? Because there are different reasons or various reasons why CS will be done. Or is it because the woman's pelvis is inadequate? If it is as a result of inadequate pelvis, there is no how such woman will ever be allowed to give birth by herself. Because the pelvis is already inadequate. So there's no how the baby will come out. So that is why I said it depends on the reason why the first CS was done. If all things being equal, there is no problem, baby size is okay, the vagina and the pelvis of the woman is okay, and then the cervix is it is felt that the cervix will dilate normally, then the only thing that will be put into consideration is the duration of the CS. When was the CS done? Was it a year ago? You cannot tell somebody that did CS about a year and a half ago to come and have vaginal birth now. So it has to stay for a while, at least more than 2 years, before such woman can be allowed to attempt. I call it attempt because it is not 100%. You won't be given 100% assurance that it has to be vaginal delivery. I hope I've answered you.
Yes, you've answered my question.
Okay,
thank you, ma'am.
Thank you very much.
Good afternoon, ma'am.
Good afternoon, ma'am.
Okay, please, I would like to confirm. You made mention that in a case where there's vaginal cuts and there's a stitch, or when there's any form of stitch, it's advisable not to use hot water or anything on it.
Yes.
Then I want to confirm, is that information just for somebody that has a cut or that was stitched, or general after vaginal birth? Because I remember my mom saying that when you do that, it helps bring out the bad blood comes out.
No. The bad blood, whatever blood it is not inside the vagina now. It is in the uterus. Okay. What I meant by that is whenever a woman has an episiotomy, that is a cut, whether she was given a cut or the place tore on its own self-tear and it was sutured, that is, it was sewn. That material we use in stitching that place is absorbable. And if you use hot water on it, it will melt. Okay? And when it melts, it means that there will be a breakdown of that wound. The wound will not oppose very well, will not join together very well because of the hot water. So by so doing, such woman will have to come back again to the hospital to repeat that process. You know what pain that could be. You get me?
Yes, ma'am. So I'm asking, in a case where there was no cut and there was no stitch, if they go
If there
ahead,
is no,
are you
if there is no stitch, if you want to sit on the water, no problem. But when there is a cut and there is a stitch, please stay. Did you get that? Hello,
Yes,
ma'am.
ma. Yes. Yes, I got you, ma. Thank you, ma.
Okay. Once there is a stitch, there should be no hot water because it will melt.
Thank you, ma.
Welcome, ma'am. Hello. Hello, house. Is there another person with a question or questions? Hello?
Good afternoon, ma'am.
How has been your day?
Good afternoon, ma'am.
Good afternoon. How's your day, ma'am?
Olatunji Oluwashola.
Okay, thank you.
Yes, ma'am.
Yes,
Ma, is it possible that after delivery, like after delivery, you're already okay and everything, and the stitches got loosened, and you just want to tighten the vagina back, you want to stitch it back, can it still be done? That's not immediately after delivery, maybe like 6 months after, and you find out that the place is loosed and everything. Can you still come back to the hospital to be
wait.
restitched back?
Let me get that right. Let me get you right. Is it the stitched area that
Yes,
or
the stitched area. Yes.
the stitched area?
Like you realize that after delivery, whenever they stitch you, it still got loosened due to hot water, and maybe you now finally felt like I finished delivery, I don't want to deliver again. And you now still want to come back to the hospital to just try and stitch the whole place back. Is it possible?
Yes, it is possible. If it is that the place that was sutured got broken down, did not heal well, kind of, there is a kind of gap there, then it can be reopposed. That is a minor policy in form of an operation now. Okay,
Okay.
can be done.
Okay. 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 Okay, ma. Okay, ma. Thank you, ma.
Yes, ma'am.
Hello, ma.
Yes, good afternoon.
Good afternoon.
Yes, ma'am.
Yeah, please, I want to ask a question, not directly related to what we have learned today.
Okay, no problem.
Yes, it's about antenatal drugs.
Okay.
What happens in the case where you take the prescribed drugs and it's nauseating you? Like anytime you take the drugs, you get to throw up or something.
You
What
get to
can one?
throw up.
Yes.
Okay, I would like to know the age of the pregnancy.
About 4 months.
Well, at 4 months, you are not expected to vomit again, but some rare occasions, they still do vomit. Some people can even vomit till they give birth. Okay? In a situation like that, what you do is you can use something, maybe something like drink, any drink that you think you like, you can use it to take, because it is the smell of the drug that is making you having it's making you feeling nauseated, and that is what is making you to vomit, because of the smell coming out from the drug. So you can mask the smell by using either fruit drinks or soft drinks to take the drug. Or better still, for someone like me, those days when I don't like taking, not nowadays anymore, I'll put it inside a bolus of a bar or temo or something, just to swallow it.
Okay, ma, thank you. But actually, the drug that was even administered is capsule like, so it doesn't even have a smell. But anytime it gets into my system, it's
Which capsule is it? Is it
Emivite. Is it Emivite?
Emivite?
Yes.
Emivite.
Yes, Emivite.
Okay. If the capsule, if your system doesn't like the capsule, you can tell your doctor so that he can now prescribe the tablet for you. There is a tablet form of that.
Okay.
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 It has a tablet form.
Okay, ma. Thank you, ma.
You're welcome.
Good afternoon, ma.
Good afternoon, ma. You're welcome.
Yes, ma. Sorry, I want to ask a question. Thanks for the presentation, ma. Yeah, I want to ask a question about some people always say that pineapple induce labor. Eating of pineapple.
Pineapple induce what?
Labor.
Labor.
So I want to ask, how true is that?
Well, that I guess is a myth. It is not true. Pineapple contains vitamin C, okay? And amongst the drugs that you are being given, most especially the Ramperon capsule, some people give vitamin C separate along with other drugs, but the Ramperon that you are taking has vitamin C in it. So it is not possible that vitamin C will now make you make you to fall into labor. Okay? It is a lie.
Okay, so thank you so much, ma.
Yes, ma'am. Hello, house. Hello. Good afternoon,
Hello,
house.
Mrs. Hello, Mrs. Akibi.
Yes, ma'am. Good
Thank
afternoon,
you.
ma'am.
I think it's been a wonderful time. Yes. Wonderful afternoon with you.
Yeah, thank you, ma'am.
You can call it a day.
Okay, thank you.
You're welcome. Thank you so much. We enjoyed the topic.
Okay, thank you very much. Thank you for enjoying it. So we hope to see you some other time. Thank you. Bye-bye.
Bye, ma.
Everyone stay safe.
Bye, ma. Thanks.
Bye, ma.
Bye. Bye. Thank you.
Thank you.
Stay safe. Bye-bye.
Thank you. Thank you, ma. Bye bye.
Thank
Thank you,
you.
ma. God bless you, ma.
Bye.
Okay.